In this webinar, we will discuss clinical presentation of different types of sepsis in neonates. We can identify 4 broad scenarios of sepsis presentation. Number 1, the baby is asymptomatic, that is, the baby does not have any symptoms at all, but there are one or more perinatal risk factor for early onset sepsis. Scenario 2, the baby has symptoms suggestive of sepsis within 72 hours and there are risk factors as well. Number 3, symptoms within 72 hours, but no risk factors. Number 4, symptoms after 72 hours. The first 3 scenarios pertain to early onset sepsis, that is EOS, and then the last scenario pertains to late onset sepsis. And in any of the 4 scenarios, the baby could be in the hospital as well as at home. Let us examine what are the perinatal risk factors for early onset sepsis. These are classified into 2 categories, namely extreme risk factors such as rupture of the membrane for more than 72 hours, chorioamnionitis, foul smelling liquor, and other risk factors, namely spontaneous preterm labor, prolonged labor for more than 24 hours, unclean PV examination. The likelihood of sepsis is greater when the extreme risk factors are present compared to when other risk factors are present. In next few slides, we will discuss scenario based management of babies. So, what we do in scenario 1? If there are extreme perinatal risk factors, namely chorioamnionitis or foul smelling liquor or rupture of membrane for more than 72 hours, start antibiotics. If there are other risk factors, follow these babies with examination of vital parameters and for development of any signs of sepsis every 6 to 12 hours for 72 hours. If the baby develops a sign suggestive of sepsis or there is a hemodynamic instability at any time, antibiotics must be initiated. We should always take blood culture before starting antibiotics in both the circumstances, and we need to perform LP if subsequently culture comes positive. In scenario 2, if the baby is symptomatic and has one or more risk factors, then the baby should be started on antibiotics and perform blood culture before starting antibiotics and perform lumbar puncture as well. Now, let us examine scenario 3 and 4 together, that is a symptomatic baby before and after 72 hours of life. As indicated earlier, such babies can be in the homes or already admitted in the hospital for some other reason. These babies can have one or more of the following signs: lethargy and poor feeding. Sometimes a caregiver, a mother or a nurse may report that the baby does not look well, and this can be an important early sign of sepsis. Respiratory distress, apnea, fever, hypothermia, vomiting, diarrhea or abdominal distension, seizures, encephalopathy, poor perfusion, shock, and rarely there could be bleeding, scleroderma or renal failure. What do we do in scenario 3 and 4? Assess the level of sickness in the baby. If the baby is too sick, as evidenced by presence of shock, scleroderma, bleeding tendency or respiratory failure requiring ventilation, seizures in absence of HI, severe hypothermia or any obvious signs of sepsis such as cellulitis, antibiotics must be initiated immediately in such babies. However, if the baby is not so sick, such as there is just an isolated episode of apnea or an occasional vomiting or transient temperature instability or some reduced activity, mild tachypnea, we need not start antibiotic immediately. In such babies, we do sepsis screen and start antibiotics only if the sepsis screen is positive. If the sepsis screen comes negative, the alternate cause for the symptoms should be looked for, and then the baby is followed up closely, and again always take blood culture before starting antibiotics. Key messages are therefore that the sepsis can manifest in different ways. The baby can be asymptomatic and there could be just perinatal risk factors, or there could be symptomatic baby and then generally the symptoms are non-specific and can pertain to any organ system. In a sick baby or a baby with extreme risk factor, start antibiotics, but in not so sick baby, perform sepsis screen. If other perinatal risk factors are present, follow the baby. Treat if sepsis screen is positive or baby becomes symptomatic respectively. Thank you.